So today we're starting a new series about communication. Communication, very unimportant in human-to-human interactions. Don't need to know a lot about it, but I just want to spend some time talking about. Obviously, very important, right? Very important topic. And there's four kind of tenets of communication that I really want you to kind of think through. These tenets, these ideas are the four topics we're going to be working through. One is called the curse of knowledge, which we're spending time talking about today. There's also what is the core knowledge that each of us have in any type of interaction. Clarity, how do we speak clearly so that people can understand what we're saying? And also story, how do we engage the listener by framing what we have to say in the form of a story. But today, curse of knowledge, the kiss of knowledge. So, this is a concept that was made familiar to me like 2 or 3 years ago. Didn't have any idea what it was, but it's actually a scientific, psychological term that is of cognitive bias. Cognitive bias is something that's happening to you that you don't realize. So when you have an appreciation, or you have knowledge of something, or you have some type of understanding of a process, you possess something that somebody doesn't else have. And that's the cognitive bias of forgetting what it was like to know about the topic, right? We all have done this. We all have these instances in our lives. One of the beautiful examples of this, I'm really, really great at this, is giving somebody directions that you know cold. So for example, if I was to give you directions to the hospital right now, I would say you're going to go out of the parking lot and take a left, and then when you come to the big street, you're going to take a right, and then when you come to the light, you take a left, and then when you go to the plant store, you take a right, and then you take a left. For me, that's really, really straightforward, but for somebody that's not from here, there's a large gap of their understanding. Now, even people in this room would be like, oh, I know what you're talking about. I could follow those directions. Another beautiful example of this is baking when it comes to elderly women. So, for example, my grandmother, unbelievable apple pies. Unbelievable. It's borderline illegal. And so I would try these pies, and what made the pies amazing was the pie crust. And so I'd say, Grandma, how did you make this pie crust? And she would say, oh, it's easy. You just get some water and some sugar and some butter and some flour and some ice. And I'm like, okay, stop. Water, flour, butter, and sugar, that's what you use to make this? Yeah, you just mix them all together in a little bowl and you just roll it out, and then that's the pie crust. I tried this several times. It did not turn out like Grandma recommended that it would. Because there were things within that process, things within her knowledge bank that she had worked through, and she forgot what it was like to be in my perspective, right? It's the temperature of the water. It's the amount of time you knead the butter. It's how thin the butter is sliced before it's put into the flour. It's the type of kneading mechanism that you use when you combine the butter with the flour. It's the time in which you add the water, how much water you add at the right time. All those little pieces are part of this idea of the curse of knowledge. So I'm going to demonstrate the curse of knowledge to you live right now. So if two volunteers come forward, volunteers, yes. Unfortunately, not going to hear this online. I apologize. All right. Who wants to be my musician?
I will.
Wonderful. So Hannah, go out the room. Wonderful. Okay. And when the door closes. Okay. Some of you have seen this demonstration before. Have you ever heard the song Happy Birthday? Excellent. What I want you to do is you're going to tap this song. You guys hear that? You can hear it, Happy Birthday? And let's see if Hannah can guess the song. Ready? Bring her back in. All right, Hannah, come on in. So Hannah is going to attempt to guess the title of a song that Ashley is going to drum for you on the desk.
Yeah.
Take it away. Ashley, I'm going to get this microphone close to your knocking. Here it comes. Take it away. You can knock as much as you like. No, do the whole song. Whole song.
Can I guess anytime?
Anytime.
Is it Happy Birthday?
Nice job. Wow. Amazing. Now, for us, it comes super quick, right? You guys can have a seat. Thank you so much. Give him a hand. Honestly, really great job. So for us, it comes super naturally, right? Like that first little stanza, doot, 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 boom, and you're on it, right? But for somebody that doesn't have that core knowledge, they've got to lean in a little bit more. They've got to think about it a little deeper. What is that? I've heard that before. It's not as clear to me. And honestly, truth be told, most of the time, we didn't have a genius guessing the song. People don't get it, and it seems really straightforward. So when it comes to knowledge that we obtain or have, our understanding biases us from knowing exactly what is the appropriate way of communicating that. So specifically, this is how I like to think of the curse of knowledge. All of us have an idea or a framework in which we understand things on a scale of 1 to 10, right? So if I don't know anything about a topic, I'm level 1. And if I know a lot about a topic, I'm a level 10. So if I'm talking about like ENT surgery, probably somewhere around a 9 or 10, right? If I'm talking to a patient, they're probably somewhere around a 2 or 3. Unless they've Googled some things, they might be a 1 or a 0. So now, that being said, when I go to communicate with that patient about the topic, it's not necessarily that I don't understand that I need to communicate at a lower level, but I don't understand how low the level needs to be, right? And that doesn't mean people are incompetent, but my bias is that when I communicate to someone who has a 1-level knowledge, that I'm meeting them where they are, but I'm really not. I'm communicating at a 5 or a 4, right? And so there's still a gap between where the person is and where your knowledge is. That gap is essentially the curse of knowledge. So how do you know if you're struggling with it? 6 signs. There's 6 signs of suffering, okay? The first one is jargon. All right. Live test for our non-medical people in the room. Ready? The patient needs a BMT and a TNA under MAC at NAMC. We need to send her to the PAT before she has this BMT for COME. What did I say? Clinical people, any idea what I said? I'm going to say it one more time. She needs a BMT and a TNA at NAMC under MAC. She needs to go to PAT because she has a diagnosis of COME. Where are we going? Nice. I got that one. We're going to Nancy. I know that one. Curse of knowledge, nothing. Good, right? So well done, non-clinician. So honestly, that if people are saying, "Whoa, what was that?" There's like some acronym you used. What was the phrasing that you said? That is a sign that people aren't understanding that you are suffering from the curse of knowledge. And it's really easy for us in our world, like BMT, TNA, MAC. Those are just acronyms that we use on a daily basis. We don't think about it. But when people start to go, "What?" That's a sign or a clue to you that you are a sufferer of the curse of knowledge, and it's affecting you. Number 2 is pace, right? If I am a patient and I'm going to explain to them, what are the steps of a thyroidectomy? I'm like, well, it's pretty straightforward. What we're going to do is make an incision through the skin, right, 2 fingerprints above the clavicle through the skin and subcutaneous tissue, then probably go to the strap muscles. We're going to divide them in half, divide them anteriorly, look at the jugular vein, divide the jugular vein, and if I start talking really fast, the patient's going to be like, I heard a lot of names. Were you talking about me? No. When you get accused of speaking too quickly, then you are suffering from the curse of knowledge because your brain is at pace with where you currently are. So when you're in conversation with someone, there's a lot of outside stress, there's a lot of things that you're thinking about simultaneously, and if your pace increases, you are dealing with that curse of knowledge. The next is assumptions. And assumptions, probably as you would guess, is specifically thinking that somebody doesn't need convincing. Somebody doesn't need to understand where you are in the topic. So here's a good example. Somebody comes into the ENT center for the first time, and they've been here for a week, and you're like, "Hey, how's it going?" "Oh, it's going great. I like it. I like the vibe. I like the people that I'm working with. Everybody seems to be super, super nice. Really? Okay, awesome. So what are your priorities?" What? Like, what are your priorities? What are the things that you're focusing on? I mean, getting here on time. Making sure I don't forget to clock in. Oh man, Morgan is really strict on that one. Making sure that I check my email every day. I think, right? Oh no, we have like specific rocks and priorities that we want to make sure we push our mission forward. I was supposed to bring a rock to work. What? No. So us having the understanding that, priorities are important. Priorities are what we put first because we know we only have so much bandwidth or capacity in the day to do certain things. a normal human being, a normal person coming into a work environment that's not used to that is not going to be aware of that, not going to be understanding why that's important. And so having those type of conversations, and that's not just about priorities, that's anything that's specific to the team that you're on or the social group that you're in. Not making the mistake that somebody doesn't possess the same knowledge that you do. Did I skip one? I sure did. Abstraction. So abstraction specifically is using abstract terminology when you're conversing with someone. And this isn't jargon. So like you may understand this term. So if you're shooting a social media video with our social media team and they're like, hey, we want to shoot a social media video about the coffee shop. And Chloe stands up there and goes, all right, yeah, here we go. Let's do it. So coffee's pretty great. And come on by. Because we currently don't have any hot water. But anyway, besides that, the coffee's awesome. Hey, Chloe, love the attitude, love the vibe, but could you use some more viral hooks in your terminology? Chloe's like, yeah, what? You want me to like get a hook with coronavirus on it? I don't think the patients would like that, right? No. Calm down, everyone. We have to use specific non-abstract ideas, right? For somebody in the social media world, a viral hook, and most people in general, would understand what that is, right? It's something that's going to grab the audience very quickly because it's something that's really compelling or something that's really polarizing, right? Those terms, that kind of language makes people watch a video. But when I'm talking to somebody, not that Chloe doesn't know a ton about social media, but when I'm talking to somebody that's not in our specialty or in our field, not using abstract ideologies to explain it, right? And again, the person you're speaking with will not always tell you, excuse me, I don't understand what you're talking about, because there's a weight on them to feel competent, right? So if I say, hey, you need to use a viral hook for this video, it's going to make it much more engaging, and I don't know what you're talking about, I have to risk sounding incompetent to say, I don't really know what that means. So just because you're communicating something and you say to the person, does that make sense? Which I say almost at the end of every sentence. If somebody looks at me and just goes, okay, do they really understand what I'm talking about? Or am I suffering from the curse of knowledge? An idea that I think I understand or I'm communicating something well, but I'm not actually hitting the mark. The next is context. And context is really understanding why it matters to talk about what you're talking about, right? Mr. Johnson, welcome to your allergy shot. We're really excited to make you feel better. We're going to give you this allergy shot, and then you're going to need to wait in the clinic for 30 minutes, at which point your timer in the form of an allergy app will go off, and then we'll check your arm to make sure everything looks good. Mr. Johnson looks at you and goes, okay. I'm not going to stay. I know why they want me to stay. It's because they want me to spend 30 minutes in that coffee shop, so I buy a couple cups of coffee. I'm ahead of it. I'm not doing that, right? No. The reason we want you to stay is because we're treating your allergies. Allergies can cause inflammation of the sinuses and the nose, but they can also cause a real bad problem called anaphylaxis, which could close off your breathing. And you may have difficulties with a lot of other very important bodily functions. And so if we don't monitor you in the office for at least 30 minutes, we may miss a really potentially bad event, right? So now I've given a little bit more context to why I'm asking you to do this. I'm not just assuming, everybody knows that you have to wait for 30 minutes. No, here's the context of why I'm giving you that recommendation. And finally, buy-in. And this one, honestly, sometimes in the midst of a communication event is the most important. Every person in this room is dealing with this right now, right? And that is, what's in it for me? Why should I listen to this? Should I listen to this because my boss is up here talking, and if I don't at least seem engaged, it's probably going to make him upset? No, like, what's in it for me? The purpose of this current discussion is because we want to improve our communication in general, right? So practicing these steps, practicing this type of dialogue is going to improve us as individuals and improve us in our team dynamics. But when you're talking to anybody, you've probably experienced this before. Are you listening to me? Do you care about what I'm saying right now? Hey, you just got on your phone in the middle of our conversation. Obviously, you don't care what I'm saying, right? That's because you, as the communicator, haven't answered that question. What's in it for me? When we talk about processes and we talk about implementing new systems and training, we always have to answer that question for people. We have to answer the question, why is it important and what's in it for you to know this? If you know this, life's going to be easier. Patients are going to be treated better. You're going to be able to get through the day more easily, right? That's what's in it for you. If you answer that question during communication, people are going to be much more bought in to what you're saying. So when you're talking, if people are asking you what, or they're asking you to slow down, or they're looking at you funny, or they're kind of looking zoned out, those are signs to you that you are suffering, like we all do, from the curse of knowledge. So now, specifically, how are you going to avoid it? What are we going to do? And I created this, Ellie didn't, so don't judge the artwork, don't judge it from Ellie's perspective. This is a memory tool, okay? There's 3 steps, and this is what you're going to do to avoid this specific curse of knowledge. I was going to give you 3 bullet points, but a lot of times it's very difficult to remember 3 abstract ideas. So these are 3 ways to give communication in the way that's going to avoid the curse of knowledge, right? And number 1, I want you to think about, you're going to frame the idea. Number 2, you're going to start at step 1. And number 3, you're going to anticipate the questions that are going to be asked. So if you can picture this image in your mind, actually on the back page, I have a space for you to redraw the image. You're going to be able to avoid it as best as you possibly can. So let's use the example from our allergy shot patient. Okay, so Mr. Johnson's in the chair. I've given him his shot. I'm going to say, Mr. Johnson, I know this is your first allergy shot. And so I want to explain to you some important details. I just framed it, right? First-time patient. These are some important details because this is the first time you've experienced this. Step 1, you always are going to have to wait in the clinic for 30 minutes after the shot because we have to monitor you for any possible bad reactions. Bad reactions could include swelling, pain, soreness, itching, difficulty breathing, starting at level 1, moving up the scale of complexity, and then anticipating questions. What happens if I have a reaction? I'm so glad you asked. You're going to have an EpiPen with you. And actually, we'll keep it here in the clinic for you. Just in case you ever have an adverse reaction to the shot, you're going to give it to yourself. And this is how you use an EpiPen, right? I framed it, first-time patient. I started at step 1, and I anticipated the questions. We are never able to completely overcome our cognitive biases. Wherever we're in communication with individuals, we're going to suffer from the curse of knowledge, from lack of clarity, from difficulty in storytelling, all the different pieces of communication that are difficult for us. But if we can frame it, if we can start at the baseline, and we can anticipate questions, then we can overcome pieces of the curse of knowledge that inhibit our communication. And so when somebody says something to someone else, and you get a story of that, there are pieces of that curse of knowledge that are inhibiting that communication. And now you can coach, or now you can clarify, or now you can reframe so that communication is better. Sound good? Sound awesome? I think that's it, unless anybody has any other announcements. So take about 2 or 3 minutes, read through this, draw that out, and I will. I think we're done for the day after this, right? Awesome, super duper.